Welcome to the third presentation, and now we're going to talk about what we do to help treat these conditions and what you can also do to help yourself, because if we teach you how to do these things, you don't have to see me all the time. In fact, the only time I really love to see my patients is when they're feeling great. Then they know what we're doing is working. So what do we do to help treat these types of conditions? Well, obviously it's a chiropractic facility. So one of the things that we use is chiropractic care. We use mild manipulation, and we treat many different kinds of conditions, from herniated bulging discs to degenerative arthritis to pain and numbness, all kinds of extremity problems, whether it's your hip or your knee, your foot, shoulder, elbow, or wrist. We treat all these conditions, and I've been doing this for 30 or 40 years. In fact, like I said, I was crippled in my 20s. I'm pain-free, and I'm in my late 60s. So you have to understand that this stuff really works, and it doesn't matter how old you are, because you can improve it. But what I found when I was in chiropractic school, and as I got out of chiropractic school, although my pain was getting better and my condition was better, it was always still there. So I started to learn about other techniques and procedures that I felt were extremely important. One was physical treatment, which is called neuromuscular reeducation, where we work with the muscles, the ligaments, and the tendons. We palpate the areas. You feel the pain. We feel the swelling fibers and vertebra or body parts that are out of alignment, and work on the muscles, the ligaments, and tendons to help restore normal function in the joint. So once we can restore normal function to the joint, manipulation really requires very little force, if any at all. Now, once everything is back in alignment and is feeling better, now we have to make everything stronger and more flexible again. Because if you had the injuries for maybe sometimes months, sometimes weeks, sometimes decades, it's going to require a lot of time exercising, doing the proper exercise to help restore you back to perfect health. So it's going to be a combination of progressive resistance and flexibility exercises to make your body functional. Listen, if I just treat you and that's all I do, I can tell you right now the pain will probably come back. I doubt it'll just stay away on its own. It may, but I doubt it, because it's just the many decades that I've been working with patients. So we not only show you how to do the exercises properly to rehabilitate your body and make your body stronger and more functional and get rid of your pain, but then we show you how to find these pressure points that we talked about before, the neuromuscular points that you're going to find all over your body that will help you find, and all of a sudden you're going to start feeling better and better. So we're going to be doing all of this and helping you every step of the way. We also do something called cranial therapy. Now, cranial therapy, I know many people really never heard of before, but it's something that's really phenomenal. And chiropractic works well, and it works with the spinal cord, which is only 20% of your nervous system. 80-90% is found in your cranium. So cranial therapy can help all kinds of headaches, problems with balance and equilibrium. I can't tell you how many patients tell me about that, especially when they're in their 60s and their 70s. Allergy and sinus conditions, TMJ problems, that's jaw, temporomandibular joint dysfunction, seizures, blood pressure. Sometimes your blood pressure is due to intracranial pressures, sight and hearing problems, Bell's palsy, which is basically stress on one of your cranial nerves that cause the muscles in the face to just not work, and your face droops on that side. Trigeminal neuralgia, facial pain. It's really severe. When you have that, that's one of the most excruciating pains out there. Cranial therapy is fantastic for that. And not many doctors utilize cranial sacral work. So you have to work with the muscles. You have to work with the cranium itself. The cranial bones do move slightly. They kind of interlock like a jigsaw puzzle, but they do move to help circulation of blood and something called cerebral spinal fluid that helps perpetuate neurological function in the body. And like I said, these are all the different things that you treat. We also work with organs. We work to help improve lung function, heart function, blood pressure, kidney function, digestive function, menstrual conditions, gallbladder and kidney stones, diabetes, you name it. A lot of the treatment that we do can help improve circulation, lymphatic drainage, improve nerve supply, help reposition organs, and take a lot of stress off the organ itself due to adhesions and traumas to those particular organs from injuries or blows to the abdomen or the chest.